Tonight, people in Dane County told leaders how they feel money to fight the opioid epidemic should be used in their communities.
And that money will come from two global opioid settlements. Armand Rahman reports. Armand?
Eric and Charlotte, Dane County Board supervisors say they don't know exactly how much the county is going to receive just yet. Last month, they heard from public health leaders, the medical examiner's office, and other officials. Now, supervisors say it's time to incorporate more feedback from those impacted the most.
I'm losing people every week. Every week people are dying to, the opioid epidemic.
It's people like Joe Gailey, a certified peer support specialist and recovery coach that the county's Health and Human Needs Committee hope to hear from one day.
We're hoping to see and hear from the community about those gaps in services and how this limited amount of money, but certainly an opportunity with this revenue coming in to serve more folks in a strategic way that really makes a difference and saves lives.
Community members shared where they want to see future funds from two opioid settlements go.
We're talking about, an expected $18 million, including, money that we've already received and some that we've already spent.
County officials say so far the money's been spent on things like education and outreach through safe communities, overdose aid kit or OAK boxes, which contain Narcan and more. But they know there's more barriers.
Needs we might not think exist, like transportation to treatment, that are barriers for folks, right? That many of us take for granted, being able to drive to the doctor or something like that.
And I'm also a person with shared lived experience. I struggled for 22 years.
Gailey, along with others, advocated for more harm reduction programs, a safe use site in the county, and a drug tracking program.
So we can really see what kind of stuff is coming into Madison, into the supply. That way we can get that out to the emergency rooms, hospitals, law enforcement, and different agencies.
As the Department of Human Services and the county begin crafting their budget for next year, county supervisors say it's important to hear these ideas from the people on the front lines of the opioid epidemic.
I can't do my job every day without the dollars. And unfortunately, I come and I speak all the time to these things, and sometimes the dollars just don't go where it's needed the most.
Wisconsin's Department of Health Services expects the state will get $8 million in settlement payments in fiscal year 2024. Last month, state lawmakers approved a plan which includes $2.9 million for fentanyl test strips and Narcan and $2.5 million for room and board for Medicaid members getting substance abuse treatment.